So this week we're looking at culture and health. These are our learning objectives for the week. It's pretty straightforward and the slides follow this pretty closely. So one more reminder to make sure you can meet all the learning objectives for each week because that's what the quizzes and exam is going to be based on. All right, the importance of culture to health. I feel like there's so much that we can say about this. You really could just have a whole class just talking about this. But of course, PHLT 307 for global health really is more of an overview class. Looking at all the chapters, we go over all of these chapters, and I feel like each chapter itself could be its own semester-long course. And so there's so much interesting information to share about culture and health. But unfortunately, we can just, kind of skim the top and give y'all enough of a foundational understanding of this that y'all could go and build on it in the future, which is a shame because this is such an interesting area. We'll try to go into as much as information as we can, but this really is more of giving y'all the general ideas and principles of understanding this so that y'all can build on that in whatever communities y'all happen to be in with whatever work y'all do. So, as it says here on the slide, culture is related to health behaviors. It's an important determination of people's perceptions of illness. It affects usage of health services, and different cultures have different health practices. And so an example would be China and their very well articulated system of traditional medicine. So this is an example of a Chinese traditional medicine shop and somebody measuring out ingredients. So I actually met someone several years ago who was from China, and they had a health issue that I would have considered to be pretty serious. I felt like they should have gone to a doctor and gotten some antibiotics to deal with what they were dealing with. But the individual was telling me how they didn't really feel comfortable with Western medicine and they wanted to try some traditional Chinese medicine first. And that's totally within their rights. That's what they're used to. I don't understand traditional Chinese medicine. Maybe whatever they wanted to take first would really work. I'm really not sure. But it was a very different sort of conversation than what I'm used to having when I talk to people about their health issues. And it's just a great example that we live in a very diverse world with very diverse systems of thinking about health and wellness and medicine. And we have to keep that in mind as we're approaching any public health issue or just general healthcare issue. What culture does this person come from? And how do you respect that and speak to that in order to make the most impact on their health? And so before we get further, we do want to share a definition of what culture is. For this class, we're going to say that culture is behavior and beliefs that are learned and shared. That's pretty general, but really that affects all of these different factors here. So family, social groups, individual growth, communication, religion, art, politics, and the economy. It all relates to behavior and beliefs that are learned and shared. And so wherever you work in the future, if that's a global health, if that's another country, or if you work in a clinic in a corner of Houston somewhere, there's going to be a culture to that place. It might be more or less familiar to you, but it's really important to just be aware that you are in a place with a certain culture and start picking up what it is so that you can speak well to it, work well within it, and use that to make the biggest impact you can in the work that you do. Other important thing to note, some cultural practices enable good health, but some do not. Culture on its own is not automatically a good or bad thing. It's really what it promotes and what comes from it. And so a lot of cultural practices are good, but some really aren't. And we have to think about how we navigate that carefully with respecting the places that we worked in, respecting that culture, but also being able to navigate maybe the negative sides that aren't helping people. All right, so we're going to go over some of the conceptual relationships between culture and health practices. And the first that we're going to look at is perceptions of illness. So in the book, it talks about how there are these different definitions between illness and disease. Gonna be honest, I feel like a lot of times in healthcare and public health, I see illness and disease used pretty interchangeably, pretty loosely. The book does say that medical anthropologists use this term a certain way, so this might be more of an anthropology thing. But for the purposes of this class, illness is defined as personal, interpersonal, and cultural reactions to disease or comfort. And so based on that definition, you can imagine that the culture has a huge background in how an illness is perceived. So for example, a certain set of signs or symptoms might be considered normal or might be considered more serious depending on where you are. An example from the book is people perhaps not taking malaria as seriously in a certain area of the world because it's considered to be pretty common. So still not a great thing, but they're not going to freak out the way I might if somebody I knew got malaria, over here in San Antonio and College Station, right? So this image here shows the amount of malaria mortality rate in children between 2000 and 2019. It's great to see that the numbers have gone down. There's way less mortality, but it's a testament to see how much malaria does spread in these areas, how it can be easy for something to, maybe the severity or the susceptibility is seen differently over there because there is so much of it. And so that's something to keep in mind. What is the perception of illness in the area that you're working in? Another is perception of disease. So the book defines disease as malfunctioning or maladaptation of biologic and psychophysiologic processes in the individual. So in the book, they're seeing illness more about perception and disease more about the, pathology, the actual biological things that are happening inside the person. And so these can be affected by a culture as well. So cultures attribute disease to a lot of different things. It could be emotional stress, supernatural causes, bodily imbalance. There's also examples of different Asian countries that believe that certain foods are cooling and certain foods are warm or hot foods, and that it's important to have a certain balance in order to maintain health. A third one is this idea of folk illness. So this is more of a cultural interpretation of where a disease is coming from. The example in the book was of people having empacho, which is this idea that food is sort of sticking to the intestinal tract and causing indigestion or causing stomach pain. And so you have to think about that. If you are going into an area where people, attribute certain diseases and illnesses and everything to certain causes that may or may not necessarily be true, how do you do health education? How do you respect where people are coming from without sounding like the outsider who doesn't really understand the group, How would you talk to somebody who feels like they're suffering from a folk illness? So these are some other examples, table 7-1 of where the cultural explanations of where disease come from. So body balances, different emotional states, supernatural causes, or even sexual causes. And then we have the prevention of illness. So cultures have taboos that concern avoiding illness. So for example, many of these taboos deal with foods to avoid during pregnancy, and that can actually negatively affect pregnant women who need a lot of good nutrition when they're pregnant. And there are a lot of varieties of rituals to avoid illness. So this picture here is from a certain tribe in Africa. I believe, excuse me. So this is a Senegalese tribe that has a ritual every 2 years to help women who are afflicted by bad spirits. And finally, we have diagnosis and treatment of illness and the use of health services. So a really important thing to note is that most people around the world, they're not automatically going to a healthcare provider when they start getting sick. And this isn't just low and middle income countries. You think of, high income countries and how, for example, if people in this class, if we got sick, you're not automatically, depending on what your symptoms are, you're not automatically going to a doctor, right? You might take medication, have chicken soup, just see if it's actually bad or if it's going to go away within a week or a couple of days, right? Going to the doctor isn't necessarily the first thing that you do. And so the book gives a really good example of what this looks like. You try treating yourself, you see if it gets worse, and then you consult some type of healer, maybe a Western doctor, whatever is available in your community. And these are referred to as patterns of resort. So this is affected by the cost of the services, the manner in which the provider treats them socially. These patterns of resort, how we deal with an illness and interact with the healthcare providers, can be determined by a lot of things, and part of that is the culture. These are some examples. So a lot of individuals in our public health classes, they want to be in somewhere in this middle block, right? A lot of y'all are planning on becoming pharmacists, different types of nurses, doctors, or dentists. But it's important to remember there are a lot of other systems that individuals might go to out there in the world. So indigenous, from midwives to witches, herbalists, bone setters, or other medical systems like traditional Chinese medicine, acupuncture, Ayurvedic. Just important to remember that there are a lot of other places that your patients might go to before you. All right. So that's just a really brief skim of different ways that culture can be affecting health and our perception of disease and illness and our patterns of resort and how we interact with illness. And we see that the risk factors for leading causes of death related to culture include nutrition and eating practices, tobacco use, unsafe sex, and hygiene. And that brings us to the big question: how can these unhealthy behaviors be changed? We know this is an issue. Now, what do we do about it? And so we have a list of 4 health behavior models that we're going to briefly look at. So my master's is in health promotion, now called the Department of Health Behavior. And in our classes, we had to have these memorized. We had to be able to apply them to different health issues. We had to be able to memorize them and write them out. I am not necessarily expecting like that level of detail from y'all. But like the learning objectives said, if y'all can basically be able to describe those and know what they are, that's good enough for the quizzes and the exams. It's also just good enough for your career, I feel. These are good models to have general knowledge of. So the first one is one that we already looked at during, I think it was week 2 of class, the ecological model. So quick review, this is just this idea that we all exist within these different levels. There's the individual level, our individual characteristics and traits like knowledge, belief, personality. Interpersonal is that next level. It's people around us, family, friends, peers, more of that immediate group of people in our social group. Then institutional or organizational, so rules, regulations, policies, and informal structures. Then community, and then public policy. And like I said, we did go over this in the first week or 2 of class, and it's just that idea of having these levels that affect us. The next big one is the health belief model. And this is this idea that people's health behavior depends on their perception of the likelihood of getting the illness, the severity of the illness, the benefits of engaging in behaviors that prevent the illness, and the barriers to engaging in preventative behaviors. So basically, it's this idea that perceived threat and your evaluation of the behavior affects your likelihood of doing the health behavior. And it's those things as well as self-efficacy. So this is an important term to remember. Self-efficacy is basically your level of confidence that you can do the health behavior. Keys to action is also usually included with the health belief model. I don't know why they didn't include that in the chapter, but I guess I'm not going to ask about that in the exam or expect you all to know that because the chapter didn't expect you to know it. But just a heads up, if you do study this in the future, the keys to action, things that remind you to do the behavior, is an important part of that. But yeah, it's basically perceived severity, perceived susceptibility, and then perceived benefits and perceived barrier all contribute to your likelihood of doing the disease based on how important you think it is and how easy you think doing the behavior is going to be. Stages of change model. So this is it's basically what you see here on the screen. Basically all these changes, stages that lead from not doing the behavior at all to being someone who maintains and does the behavior. So it has these several stages. The first is pre-contemplation. It's this stage where you are not at all considering doing the behavior. Maybe it would be good for you to start an exercise habit, but the idea of thinking about it or planning it is not even on your mind. The next stage is contemplation. So this is where you're contemplating maybe doing this. What would be the benefits? Is this something that you want to do? You're actually thinking about and considering doing it. Preparation is looking into it. You know, where could you exercise or run? What type of exercise do you want to do? How much time can you devote to this per week? How would this fit into your schedule? What do you need to buy or find to prepare to do this? Action is actually doing the thing, going out and doing the strength training, going for walks with your friends, you know, lifting weights while watching Netflix, whatever that looks like for you. And then maintenance is the stage where you've been doing the action for maybe several months or several weeks. It's become a thing that you maintain in your life. And then there is the possibility of relapse. Maybe you go back to being more sedentary or really not doing that habit. And that's perfectly normal. Not everybody just maintains for the rest of your life, but you can always get back into the other stages and get back to maintenance. But it's basically this model that shows us how people adopt habits and choose to stick with or not stick with them. The next one is diffusion of innovations model. So this shows the different layers that people fall into, these different groups that people fall into when it comes to how quickly or how easily they adopt new innovation. So people did some studies and they saw that individuals tend to fall into one of 5 groups. So you have this small group here, about 2.5% of the population who are innovators. They see a new thing coming out and they're risk takers, they're excited about it, it makes their brains light up. They want to be the one to try the fancy new thing. And so they're using it, they're making it a little more popular, they're telling other people about it. And then that eventually affects the early adopters. That's about 13.5, 14% of the population. They see that it's becoming a thing and people are using it and they want to try it out. And then we get to the larger groups, the early majority, people who see that this thing has become a foothold in society. People are kind of using it. It's up and coming. And now that they've seen enough other people doing it, they're like, oh, okay, I guess I'll try it. And they start using it. And then you get over the curve and you get more towards the laggards and the late majority. So late majority, they're more like, okay, everyone else is doing it. I might as well try. Sure, it's become a thing. They're not as risk-taking or as excited about innovation as the other groups. And finally, you have 16% who are the laggards, much less likely to pick it up or get really excited about it. They might eventually get around to, stop using their fax machines and start using email, that sort of group. But basically, this model gives us an idea of how people are going to pick up on a new thing that we put out there. So if that's, a fad, an unhealthy fad diet, or if that's a healthy, good thing that we want people to be doing, it's a really helpful thing to know what your population is. That not everyone is a laggard, but not everyone is an innovator. That it's going to be important to try to target the people who are excited and help your behavior, your device, your thing get a foothold in the community, and that eventually it will catch on and get the larger curve of the early and late majority. And also just being aware that not everybody is going to be on board. You're always going to have the 16% of laggards who may or may not ever do the thing that you want them to do. The diffusion and innovations model gives us a more nuanced idea of who we're talking to and who's going to be picking up on our stuff when we put innovations and new ideas out into a community. All right, so like this page says, understanding behaviors requires assessment of behaviors that are taking place, extent to which they're enabling better health or may harm health, underlying motivation for these behaviors, and likely responses to different approaches to changing the unhealthy behaviors. All right, I just want to toss it out there that when it comes to changing behavior, it's not as simple as just having a little having a little model here that you can just draw out, right? It's not as easy as just being able to, plug and chug and write out perceived susceptibility and perceived severities and just make a simple model of trying to explain everything. There are a lot of different layers that go into understanding behavior and being able to change it. And if you look back on all these different groups and theories that we looked at, you can easily see how they all feed into each other. So you think about the socio-ecological model. I think this one bleeds into all of them because it speaks to how there are all these different layers that affect us that we don't necessarily always have a lot of control over. And you think of that paired with the health belief model, just take perceived threat. So your perceived sense of severity about a health issue and your perceived sense of susceptibility, that can be based on a lot of things. That could be based on the people that you're around. Maybe nobody around you gets malaria, so you feel like your perceived susceptibility is really low. And maybe you never hear information about people who do get malaria or who get a certain health issue. And so your sense of severity is really low as well. You don't think it's going to be that bad, and you don't think you're going to get it. And that may or may not be true, depending on the health issue that you're looking at. But that's also impacted by other things like health education. Maybe there's not a policy for health education in schools. Maybe there aren't posters at your workplace or in your community that are warning people about a certain health issue. The level of health education can be impacted by these other organizational, community, and public policy levels, right? And so that can all impact perceived threat as well as individual interpersonal. And that's just perceived threat. I mean, not even going into all these other factors here. And then you think of stages of change, that's going to be affected by a lot of different things in your community, within your friend group, within, policies that make up the environment and the world around you. And the diffusions of innovation, that's affected by all of these other levels as well. The people around you, how easy it is to adopt something, the community and organizational structures around you. There's just a lot that goes into behavior change. And so I can't think of a single time that you just take one theory that explains everything. Being able to understand behavior and understand a community well enough to impact behavior, it is possible. It's never going to be perfect, but it is a possible thing to do. But it's not as simple as just writing out a theory and filling in the blanks and, plugging and chugging with that in your program. It really does take a very thoughtful, considerate combination of understanding these different theories together, especially the ecological model, to really understand what's going on in a system. And so I just want to throw that out there. It's not as easy as just having one theory. There's a lot that goes into it, and it's not easy and it's not perfect, but it is possible to develop a strong enough understanding to make an impact for community health. All right. Now we're going to look at the last big thing, which is how can we actually change health behavior? So we have a list of 7 things that we're going to look over. I'm not going to spend too much time on these in the interest of time, but these are gone into in more detail in the book. So of course, I'm expecting everybody to be reading that chapter and getting as much out of this as possible. The first is community mobilization. This is basically engaging the entire community in efforts to identify problems and promote healthy behaviors. And the book has a good example of this at the beginning of the chapter, talking about the women in the community working together to prevent low birth or low weights in their babies. Important thing to note is that it's really important to have leaders in the community who are willing to champion change. And this is true in just about any community that you work with, whether that's a community in a city, or maybe it's a community like a workplace. Being able to get upper administration, like higher ups, admin, leaders in a village, leaders in a city, to buy into something and be champions is really important for any sort of mobilization that you do within a group. Other thing, mass media. So edutainment, like making it fun to be learning things and be plugged into stuff, that is so, so valuable. And a way that we see this done in a lot of low and middle income countries is through radio dramas or radio soap operas. I'm going to include a link this week in Canvas to an example of this and how this is done for like mental health and healthy relationship radio programs in other countries. This is a great way to plug into that. And then social media. So the book does talk about how there are growing higher than we might realize numbers of individuals who have smartphones and access to internet in low and middle income countries. I think that's going to be really important in the future as we consider how social media can be used globally. But right now, most of the research looking at social media is done in high income countries. And one of the main issues that we see is that social media is great for spreading information. It's a really great combination between, being entertainment and also being educational. And it's a thing that so many people are plugged into. But I'm sure we've all heard about issues with misinformation on social media. So the videos listed here, I'm not saying that they're misinformation, but it's just an example of how many videos we have out there with people pushing out stuff like, oh, this is a symptom of ADHD. This is a symptom of autism or schizophrenia or some other health issue. And that isn't necessarily true all the time, especially those videos that make it seem like every normal thing in the world is actually a symptom of some kind of health issue. And so they've done research on this, analyzing videos on TikTok, and they found that there is a ton of misleading information out there. And so that's just looking at individuals in high income countries and how that's affecting the information that we see. But if we think about those higher numbers of individuals in low and middle income countries that are also getting more and more access to social media and the internet, we have to consider what misinformation on social media is going to look like globally. And so this is a really important thing to just be aware of, thinking about how to prevent misinformation and then how to deal with it once it's out there. What's that going to look like for us as this becomes more and more of an issue? Next big one, social marketing. This one's really interesting because it's a great example of overlap between public health and a lot of other areas. So public health and more of the business world, because social marketing is taking a lot of principles from commercial marketing and using it to promote behavior change. So we're not trying to sell cereal, we're trying to sell healthy behaviors. And that depends on the 4 Ps. So product, price, places, and promotion. And I have an example of this this week in Canvas with the vaccination campaign. That is a great name. The vaccination campaign that was used during COVID to encourage tribal nation members to go and get their COVID vaccines. So all the examples I just mentioned have to do with health education, but there's also just straight up health education. And that could be in a formal classroom, that could be with mass media, people like actively teaching you about health things, not necessarily through edutainment, but just through teaching you information. And that does not have to happen just in a formal classroom, though. So the book gives an example of how barbershops in many countries are community centers where men congregate for discussion. So this is really interesting. I've included, I think it's a video, there's a link for it in Canvas this week, showing what these types of programs look like and how health education can be done in a lot of different areas. Last one we'll look at conditional and cash transfers. So this idea of governments incentivizing certain healthy behaviors by paying individuals to do them. So for example, giving money to a family for giving birth in a hospital, participating in nutrition and baby care programs, or sending female children to school. And like the book says, there is some research showing that unconditional transfers, just giving people money, might be just as effective. But it seems like it's not a set finding. It could be effective sometimes, but not all the time. But this is just an important thing to be aware of. This might be a good option in the community you're working with. Oh, okay, this is the last one, social assessment. Are we doing on time? 11:40. Okay, social assessment. This is a process for assessing the social impacts of planned interventions or events and for developing strategies for the ongoing monitoring and management of those impacts. So this is really important. Assessment before and after the fact in whatever program you're doing, just making sure that it's really impactful, that it's impactful in the right ways, and they are not going to be negatively impacting the community that you're working with, especially if it's a community that you're not a part of or not as familiar with concerning their social values or their cultural values, right? And so it's so important to be linked up with community partners, be partnered with people in that area who can really speak to this and talk about, the things you're planning on going in and changing or teaching or doing. Is that going to be really helpful or unhelpful in the short and long term for that community? And so this is very important. And it's very much not something that you just do after the fact. You want to make sure that assessment, that some kind of evaluation is always a part of your process. From the very first stages to the middle to the very end, you have different ways of checking in with the people who are doing the work, with the people in the community, seeing how it's impacting them. All right, one last time, I want to say this. It's not always as easy as just taking a behavioral theory and impacting people's health. And health education, just throwing information at people often isn't enough to change their behavior and make a really meaningful impact all the time. So I know that we just went through all these different health education methods, whether it's, radio, mass media, social marketing. I forgot the last one. There's all these different health education methods that can be done. But throwing information at people usually isn't enough to change their behavior. It can be very helpful as depending on maybe the issue or the community. But like we talked about, there's a whole ecological model that we all fall into. And a lot of those higher up levels that we have less control over are oftentimes some of the most impactful on us, right? Somebody might decide that they want to eat healthy and change their diet, but if they live far away from a grocery store and it's easier to go to a little corner store and get, processed food or less healthy foods and not have really nutritious options, that's a problem. That's a problem if you live in a food desert. And that's not necessarily something that you can change easily. Not everybody has the financial freedom or the ability, especially right now with the housing prices, not everybody has the ability to just move in a really great area that they want to be in. And so you think about things like that. Or even policy. I remember being in college when they passed legislation to ban trans fats in the US, and that was a big deal. I mean, gosh, that was really impactful. And that's definitely not something that we on a day-to-day basis have a lot of control over. And so you think about these ecological levels that we all live in. Yes, health education has a lot of value. Doing this type of outreach has a lot of value, but it's always important to think about that, the individual, their level of what they know and their knowledge, but also be aware of all of those other levels. If you tell somebody, hey, you need to be eating a lot of, fresh food and veggies, but they live in a food desert, did that really help them? Did you really speak to that person and their community and what they were going through? And you also have to think about, obviously, the culture. Are you speaking to this person in a way that meets their culture and what they maybe are expected to do, what they're used to doing, what they're used to understanding? What does that look like? Health education isn't enough. It really has to be paired with an understanding of the community, of where this person lives, of what they're doing. And when behavioral theory isn't enough. So my master's in health promotion, I feel like I could teach a whole course on this, but I just want to throw it at y'all one more time. It's not easy, it's not perfect, but it's definitely possible to have a really strong understanding of what's going on in a community and make a program or some kind of project that is impactful and does make a difference in their health. but it's not just one element. You really need that strong holistic understanding of what's going on. And that's really what public health is all about, whether you're doing that globally or whether you're, working in a clinic in Houston somewhere, having that holistic understanding of what's going on so you can really speak to people and develop programs and plans and education in a way that's really impactful and really matters. Okay, I will get off my soapbox now, but I really want to throw that out, y'all, since we've just spent so much time talking about education and theory. All right, on pages 179 to 184, there's some really good case studies that are really interesting and tie together everything we just went over in the chapter. Make sure you read those. These are the main messages for today, just tying up everything we just said. And we have the first exam coming up. So one more reminder, if you haven't already started looking into that and learning all the learning objectives and reviewing the information, make sure you're doing that now. The exam questions in terms of difficulty, it's going to be on the same level as the quiz questions. So as long as you're able to do those, the exam should not be a huge issue. There's not going to be like a sudden jump in difficulty. I'm not going to ask y'all for really tiny random details from the books and the lectures. It really is just being able to do those learning objectives. If y'all have any questions about that or have any concerns, feel free to reach out to me during office hours or with an email. And that should be it. All right, y'all. Y'all have a good week.